I am joined by Dr. Ben Carson. Dr. Carson, welcome back to the Hugh Hewitt Show.
Thank you. Always good to be with you.
Doctor, you're such a well-established and well-regarded national figure. You're the professor of neurosurgery, oncology, plastic surgery, the head of pediatric neurosurgery at Johns Hopkins University. You've won the Presidential Medal of Freedom. You did the National Prayer Breakfast. You won One Nation. If President Obama called you up right now and said, Dr. Carson, we need a Surgeon General who will command respect and will generate calm, would you please serve? Would you accept that?
No. No, because I would, if I were going to serve in that position, I would have to serve under someone that, I trusted.
If he said, I will not interfere with the guidance you give, we need someone to rally the country around being calm and appropriately prepared. You'd say no to the President of the United States?
Yes. Absolutely.
I'm shocked.
Well, you shouldn't be, because it doesn't, I look at some of the other people, and I know them, who are speaking on behalf of the administration, and I feel that they're being constrained in what they're saying.
Do you have confidence in Dr. Frieden?
I think if Dr. Frieden were 100% free to say what he wanted to say, I think he would be saying some different things.
What do you think he'd be saying?
I think he'd be saying, of course, banning flights coming from, infected areas makes sense. That would be the first thing he'd say. And, I think he would be concentrating a lot more on finding out what exactly happened to transmit this disease to healthcare workers. We still only have a vague notion, and that's really a very important piece of information to come up with.
What degree of risk, how do you convey to people who ask you the degree of risk the average American faces right now?
Well, right now, the average American doesn't face much risk at all. Bear in mind, we have excellent, medical facilities, expertise, protocols, and unless you're in direct contact with an infectious patient, you're very unlikely to contract this disease right now. However, here's the issue. If we don't get it under control in Western Africa, and it spreads across that continent and into the Middle East, where it's a more likely place for it to really catch hold, because there's a lot of poverty and sanitation is not, optimal in many places there, and that's the kind of place where this can really spread. And from there, who knows where it will spread? Who knows what happens if it gets into South and Central America? And it doesn't matter how good our protocols are at that point. We're going to be inundated.
Now, Dr. Carson, I'm just a lawyer and a broadcast journalist, and I had an exchange earlier with Tom Foreman of CNN. He's a pretty good reporter, but I took objection to a report he did on the travel ban and the efficacy. And the way I see it, if you're not a passport-holding U.S. citizen and you're a resident of the hot zone, we should not allow you in until you've been 21 days outside of that hot zone somewhere else, because it reduces our marginal risk of an additional case. That's just common sense to me. Am I right?
You're exactly right. I mean, you don't even have to be a medical expert to recognize that. I mean, that's such basic knowledge. And, many of the African countries have shut off their borders to people coming from the infected areas.
Because you just want to reduce your margin of risk. And if you have 100 people coming in, you're more at risk than if you have 10. Especially if, by the way, do you credit the WHO's estimate of 10,000 new cases a week by December?
Well, certainly there's that kind of potential. I sure hope that doesn't happen. But you know yourself from basic math, 2 times 2 is 4, times 2 is 8, times 2 is 16. You do that a few times, you get to some pretty large numbers pretty quickly.
Sure. I actually was working it out on the air, correct my very minimal epidemiology, but if we have 1,000 cases a week today and the WHO is right and it's 10,000 cases a week in 6 weeks, then one would believe that 6 weeks later you'd have 100,000 cases a week. Am I right?
It could easily happen.
Well, in that case, how do you fight a pandemic?
Well, like I said, the key is putting the people and the resources in the epicenter and getting it under control there. If it gets out of there in an uncontrolled way, forget about it.
What do you suspect, and again, you haven't treated either of the nurses who are victims of the index patient, what do you suspect happened from all you can garner? And I'm sure you're talking to a lot of sources that I don't have access to.
Well, it's very hard to say, but a lot of times when you're taking off the protective equipment, if you don't take it off in exactly the right sequence, you can become contaminated. One of the things that we learn early on when dealing with infectious diseases is how to gown and glove and mask, and just as importantly, how to degown and deglove and demask. All of those have to be done in the proper order.
A study out of the University of Minnesota suggested that respirators ought to be standard equipment for people dealing with active Ebola patients. Do you agree with that?
Respirators?
Yeah, the self-contained breathing units.
Oh, okay. Well, I'm not sure that that's necessary. We have no evidence whatsoever that it's, born by way of a respiratory pathway. However, I wouldn't strenuously object to it, because why not get out ahead of it? Why not, take extra precautions? I'd rather take extra precautions and see that I was, overdoing it than not to do enough.
Do you believe we've seen the last case in the United States generated by the index patient, not necessarily a new entrant, but by the index patient?
No way to know. Absolutely no way to know that.
All right, then I want to return to my first question, because I'm still a little bit shocked. Is there any way that the president could restore his trust, your trust in him, so that you would accept the job? Because there are very few doctors who actually could command conservative belief that this wasn't being politicized. That's the big reaction to the Ron Klain appointment today, is that it's a political guy, it's a cover-up, and that Ben Carson, as Surgeon General, would put an end to that speculation, and I believe would be a service.
If he were to demonstrate that, he really was concerned about our freedoms in this nation, and that he was willing to, say, repeal Obamacare and talk about how do we get real health care, so that I recognize that he really was interested in this being America, where we worked out our problems together, not where the government imposed its will on the people, I might consider it then.
Would you accept an invitation from him to come and talk about it at the White House?
Sure.
And has that happened yet, by the way?
No,
okay.
I've not received any invitations since the prayer breakfast.
I got to ask you now, given your role at the prayer breakfast, this week the mayor of Houston served subpoenas on pastors in Houston in an attempt to intimidate them, contrary to the First Amendment. It's thugocracy. It's like Mayor Putin of Houston. Are you surprised by that turn of events?
I was a little shocked by that it was so blatant, because it's clearly unconstitutional. And I was pleased, however, that there was such an immediate outcry. I was actually there in Houston while that was going on. I was with Pastor Ed Young down there, and they've stood up to it, and it's a wonderful example for Americans. We have to stand up for what we believe, and we have to do it right away, because the progressive movement will just keep pushing their agenda, and as long as they're getting no resistance, they will not stop.
I recommend that every Christian in America send her flowers. Just be nice and loving and ask her to stop attacking the pastors. What did Ed Young do, and what did the pastors do down there, to your knowledge?
Well, they held a press conference. They've been writing several articles. They've been doing a lot of speaking out on interviews, and just saying that they're not going to cooperate because this is an invasion of their privacy. It's an offense to religious liberty and to freedom of speech, and there's no way that they're going to submit to it.